lot of memories. But we'll share about those later on during this virtual reunion. So for our first speaker to give an overview of the discussions, agreements, and the ways forward made during the fifth GHAC, I'd like to call on Ramon San Pascual, the Executive Director of Healthcare Without Harm, Southeast Asia. Sir Mon?
Good afternoon, everyone. I hope you hear and see me in my video as well as my
Good afternoon.
presentation. Yeah, this is a very nice occasion amidst the attempt to recovery from COVID. We are now already trying to project ourselves not only for a better year in 2021, but even a more prosperous time, and hopefully we can be gathered again in the year 2022 when the next Green Hospital Asia Conference will happen in India. So what I'm about to present to you is not only looking back, but as a way of encouraging you and inspiring every one of us in the Green Hospital network in the whole Asia to keep on pushing and attend to our sustainability work as well as attend to the climate and health work in our respective hospitals. So my screen is now shared, and let me start by citing to you the numbers. My task this afternoon is to provide to you an overview of what went on, what were the agreements, how do we move forward from Singapore to India in about another 12 months. So what we had in Singapore, sponsored and hosted by Kotik Puat Hospital, and thank you to them endlessly, is the fifth Green Hospital Asian Conference, which is for the first time after 5 conferences, we have a 3-day event with 2 distinct parts, which is on one hand, this is the pre-conference, and then the next 2 days are is the conference proper. We have 3 deep dive sessions, which I will show to you later, that happened in the pre-conference. We have 5 plenary sessions. Together, on those sessions, we were able to experience and see and heard and participate in 50 parallel sessions with about the same number of presenters and speakers, 50 presenters, 50 speakers. And then if you think that there are only 3 sustainability tour sites, there were 4, including the Kotik Puat Hospital itself. Remember, we were toured in the whole facility before we broke up into 3 other sites. It was a big event participated by 20 countries, which is about 64 hospital or hospital system participants, 15 organizations, 3 ministries of health, and there are about 300 participants, including those that come from Singapore itself. In the next slide, I will show to you just a quick overview of how we run the program. Again, this is not just to look back, but to refresh you what we can do moving forward now. And what do we want to see as a matter of key topics that we want to tackle now that we experience COVID and going to recovery as we hold the next conference in India in 2022. In 2019, in the Kotik Puat Hospital, we had 3 deep dive sessions for day 1. Procurement and plastics in healthcare in the afternoon, in the morning, and then air pollution in the afternoon. So those only 3 topics constituted already the day 1 of that event. and you would see the topics bracketed per key topic, the subtopics. And then on day two, the main conference already started. And this is a long, demanding, comprehensive set of sessions and parallel sessions and plenary and many opportunities for socialization. So after the opening ceremony, you remember Josh Carliner providing the climate and health context where we were in 2019. You can imagine if we provide such a context in 2022 next year, there will be a lot of changes already with COVID in the mainstream as a key issue of both of health, but as well of climate. And then we started with plenary 1 on food, plenary 2 on waste, and this is still in the morning, and then respectively the parallel sessions. And again, you see that the key topics under food and under waste. And day two, still in the afternoon, the main conference, we have the different topics, three, plenary 4, which is on energy and building and communications. And then the parallel sessions once again. And then we have a short session in the morning on day 3, but this is already a summary session on leadership after tackling waste, after tackling food, energy, communications, and we have leadership. And remember, in the day 1, we already tackled plastics, we already tackled procurement, and we already tackled air pollution. So why leadership is important? In everything that we do, leadership is a key. And we've seen that as well in the whole event. And after all the recognition and the closing program, we went forward to the tour of Kotek Wat, Siloso Beach Resort, Marina Barrage, and then the Chuchi Eco Awareness Center. So my task really is to discuss with you what are the key issues and agreements raised across those 3 days. Again, as a matter of review. For example, on procurement, you would see there that these are just select key points. This is not a comprehensive review after all because we don't have the time, but I just choose what I think would be good for the purpose of this afternoon's gathering. So institutionalized chemical replacement, engage the public sector, particularly on certain issues that need to be replaced in the hospital, such as disinfectant, air pollution, to create evidence-based standards, engage the health sector partners. Plastic is a key topic that run across from day 1, day 2, and even a certain extent in day 3. We need to change the narrative, advocate not only for less waste in terms of plastics, but to minimize even the production. And we are encouraging hospitals, it came out, to conduct regular audit of their waste, particularly plastic waste. On climate, and this is still very true up to now, we need to align the healthcare sector with the Paris Agreement, much more with the experience of the COVID crisis, and reduce net emissions of hospitals to zero as much as possible up to 2020. And yet, in our own context in the Asia region, we need to identify the unique climate actions that are relevant and appropriate for our people and for our countries. And then on food, plant-based food benefit longevity has been given the big impression there. And then we need to reduce greenhouse gases even as we consume food, healthy food in the hospital. And I found this as a very interesting resolution to make water your drink of choice. On building and energy, these are the issues and agreements. the direct government fund to clean energy, that green building policy of the government should also cover and support hospitals, greening. Then we had a session on communications, that climate and health messages should be done at all levels, that we need to keep our messages simple, clear, and repeated often by a variety of trusted voices within the healthcare sector. And how do we show leadership? There are so many ways, but the call now is to demonstrate linkage of health and climate, or the call then in 2019. This may change a bit now with the COVID, and establish sustainability department in hospitals. Such a good resolution, and hopefully things are moving forward in your respective hospitals along that. Now the rest are feedback. I don't have much time, but I just want to return to you uh, how we process the entire conference. We took feedbacks as you went out of your room, as you moved to your site tours. You provided us some feedbacks, and these are the key things that we gathered. That we had a relevant program, life-changing information. Even it's good for someone that is new in the green hospital on climate and health. It was a jam-packed design, meaning very crowded, perhaps in terms of topics, and yet nice to have allotted time to mingle with fellow advocates. Uh, but for some who are newcomers, it may be overwhelming. And at times, the people are given that we are consuming so much time in the session, there's no more time for fellowship among international participants. Excellent speakers, informative discussion that are actionable by hospitals to kickstart green initiatives. And that there is a proposal that in the succeeding conferences, we create more mixture of academic advocates and clinical practitioners. We ask you even, what do you like best in that Singapore event? The food and hospitality, I agree fully. The content and venue, yes. Sharing by each country on their journey and achievement, and that the Kotik Pot Hospital, the venue, demonstrates and presents the theme of the conference itself. Such a good observation. And what do you like least? This may be the room for improvement. At first, the venue should be nearer to the hotels, but in the end, I also enjoy traveling, and bus was provided. This was from one particular co-participant. Very difficult for a newcomer to follow the flow of thought, but I had a better picture during the summary on the third day. I like the whole package and grateful. Okay, and you see the other areas for improvement, including registration fee, and then providing more focus on Asia context, and maybe having subgroups on specialized sectors such as young people, those that are the practitioners, and those in different types of hospitals. So thank you for everyone for joining us in this afternoon. I hope that's enough to freshen up your mind what we have gone through for why we made that conference a very successful one, for which we are humbled, and yet we are inspired to do more of this kind of conferences the moment we recover from COVID and vaccine has been introduced across countries. Thank you very much, Pat. I'm turning it over to you.
All right. So thank you very much, Mr. Ramon San Pascual, for sharing such important and insightful information. For sure, there's more that we can add, including how the conference helped its attendees, including the organizations that organized, how it helped them continue their journey towards green, sustainable healthcare. But for now, we proceed to the next part of this reunion, and that is to call on some of our conference alumni to share their experiences and lessons learned during our gathering in Singapore back in 2019. So for our first speaker, is of course representing our co-organizer, Kutek Puat Hospital. Let us all welcome Miss Yen Tan, Chief Operating Officer of KTPH in Singapore. Miss Yen?
Hi, thank you. Good afternoon to friends, actually international friends. But I also saw in the list one local friend that I'm very close with, Peter. Peter, you are here, right, Peter? Peter, are you there? I'll introduce him in a short while. Um, I was asked to give a bit of reflection from the conference, but I thought I should go before the conference, my own personal deep reflection. I want to confess that prior to attending something very important in my life, I wasn't really interested in sustainability. I was going with the flow, and it was a job, meaning it was under the role of director of operations then in Alexandra Hospital. We had a health promoting logo. I had a doctor called Dr. Michael Wong with me, and I left it to him to do most of the thinking. And to me, I didn't get really interested until I went on a journey, a sojourn journey to Taiwan. I think Dr. Lim Minan, was it 2017? Dr. Lim, can you help me here because I have amnesia coming already. It's a friend's chat,
係
right? 係闽南是2017年對不對？17 I visited you
I
or
can
one
remember.
I think it's 3
Yeah.
years ago before this conference or 2 or 3 years.
Mhm.
So it was, as the story goes, I went to Taiwan and I experienced the wonderful and deep hospitality from Dr. Lin Mingnan and his team. From the airport to the accommodation to the plant-based diet and to the way they organized the conference, and I was very supremely impressed with everything. Of course, friendship came in, and we got to know the Taiwanese friends on a very deep basis. And I saw how they weave in operational concept with health promoting concept to plant-based diet, and it's not that difficult if we put our will to it. I was very encouraged by that and came back deeply reflective. And then around about the same time, we had to do a book because we wanted to put our experience into the book to share with more people. I think my interest peaked at that time, as well as that deep reflection came in. So I really want to thank the Taiwanese counterparts here for inspiring me. Still do. And there's a lot of things that I could do in my capacity to influence. And then my real reflection from the conference is um, Singapore is very typical. Government say we will do. I mean, it's not. It's a known fact, and we are obedient. We do have a mind of our own, but we're largely very compliant in healthcare terms. So few weeks ago when we organized the conference, my personal regret is that I couldn't get more people to join us on this journey. Perhaps their awakening hasn't come. So I wanted to be the Taiwan conference to them. I wanted to be the Taiwan conference to them. And but I could not do for some hospital because it's not in their prime agenda. But the opportunity is here. So I put together just 3 slides, and um, I thought I'd share here just 3 main points. Um, I think it's unfortunate that COVID-19 derailed our progress, but because it culminated in a lot of wastages of earth resources, it pushed us in our resolve, in our resolution to do something about it. And I think worldwide, everybody is like reflecting. And I want to use the word humbly that Singapore is beginning to focus on sustainability in a very concerted way. And our Minister of Sustainability and Environment. So last year actually, when we had the new general election, instead of Ministry of Environment, they added the word sustainability before environment. So I think it's a very good recognition that there is no environment if there's no sustainability. So it's not environment and sustainability, very interestingly. And it's a female minister, and I met her when she visited one of the patients here. I went up to her, accosted her at the lift, and I told her, I said, Minister, I'd like to give you a book that we authored. And she looked at it, she said, oh, wow. And then I told her that we're having another big clean and green week this year. Can you be our guest of honor? She said, sure, write me a letter. That's in November. And we started the conversation going. So she I don't think she's inspired a book to do all these things. She really has it in the plan. So she announced as part of this year budget that we're going to focus on sustainability in a big way. So had this come in 2018, then I won't have the regret of 2019. That is, more hospitals likely will come on board. And I'm hoping that with or without the government push, we should recognize our worldwide citizen responsibility to do something about it. Come on board. We don't need Raymond, we don't need Peter, we don't need Yen to remind that we have to be sustainable in order to live in this world. So this is my reflection, and I think there's a lot of possibility in the future. I think there's a next slide, if I may have the next slide. Or is it only one slide? I had three, I thought.
Yeah, only one slide.
Thank you. So if the government announced in a way, I think all of us will play ball. So I'm just going to say and rest at that this is my reflection, not so much on the conference, but what we could do more and what we didn't do well, what we could learn. And thankfully, the government is coming on board. And with this, more hospitals will come on board. And Peter is a friend. He now heads the procurement agency of Singapore for all healthcare. We use a lot of wastages. We do a lot of resourcing on Earth. So we're trying to influence Peter and the team and convince them to come on board. And I think I don't need a lot of convincing. He's probably on board already. So thank you very much for asking me to say something.
Your testimonial that goes beyond the conference and the support given by KTPH during the 5th GHAC is truly appreciated, Miss Yen. So thank you very much. May I now call on Miss Chu Tzu Chen, representing the Health Promotion Administration of Taiwan, which is one of our platinum sponsors during the conference. The HPA actually is also an active partner of GGHH in pursuing green, sustainable, and climate resilient healthcare in Taiwan and beyond. Let us all welcome Ms. Chen. Ms. Chen?
Okay, thank you for the introduction. Good afternoon, everyone. I'm Zhu Chen from Health Promotion Administration under Ministry of Health and Welfare in Taiwan. I'm very glad to join this virtual reunion. Taiwan HPA participated in the 5th GHAC in last October of 2019. We shared our experience as health promotion government agency and the result of promoting environmental friendly hospital initiatives in Taiwan, both public and private. During the conference, we also learned about hardware facilities, food storage and waste processing, waste disposal, and energy management from other participating countries. Here is a brief description of Taiwan's achievement in 2020 and the prospect for the foreseeable future. To talk about promotion of environment-friendly hospitals in 2020 in Taiwan, first of all, we revised and updated the blueprint and our guidelines for environment-friendly hospitals in Taiwan by referencing latest information available abroad and domestically, as well as suggestions from experts and staffs work in the hospitals. Second, we update our healthy hospital certification standards by incorporating climate change mitigation and adaptation capacity building for healthy hospitals. So that means we hope the certified healthy hospitals must be able to well respond to climate change issues, especially in their healthcare service. So on the other hand, for the capacity building, we organize education training sessions and held an international workshop for the frontline practitioners in hospitals so that they can learn new knowledge and exchange experience while the workshop. So moving forward, we will continuing to follow up the international informations of this issue, and we will work closely with our collaboration with Griffith University of Australia, and we will try our best to lead our medical institutions toward a greener and more sustainable operation. So finally, we hope to learn more about the green hospitals promotion and the strategies on medical service under the context of climate change mitigation and adaptation. In addition, we have heard the good and successful cases from the conference of promoting green hospitals. And we are very interested in knowing what are the incentives of these successful cases, so that this experience can be used as the reference for government departments to formulate of policies. So that's my experience sharing, but I have to say that what I shared is just the view of Department of Government. In Taiwan, there are many hospitals have done the excellent job in promoting environment-friendly hospital, such as Daling Ciji. And so we will try our best to work with our hospitals to move forward more greener and more sustainable operations. Thank you very much.
Thank you very much, Ms. Chen and HPA Taiwan, for being a big part of the 5th GHAC, as well as your contributions in terms of our work with GGHH. All right, so for our next speaker is Dr. Linda Lim Varona. She is the director of the Lifestyle Medicine Department of the Adventist Medical Center Manila in the Philippines. Other than Dr. Linda's pleasant energy, her presentation on the healthy plant-based diet very much made a positive impact on a lot of our 5th GHAC attendees. To share more about Adventist Med Manila's journey after the 5th GHAC, let us all welcome Dr. Linda Varona. Doc Linda?
Yes, good afternoon to everyone, and it is a pleasure for me to be given this chance to share what we learned and how we are coping or applying what we learned in that 5th GHAC conference. And I would say that when the video was shown earlier about the things that happened in the hospital, I had what do you call that? The memories came back, and I really enjoyed the place. We really enjoyed it. Was not just a conference, it was a break from our usual environment, and it was really a welcome delight for us. And we enjoyed even the food and the hospitality of the people there. And if you will recall, I gave a lecture. I shared our experience about the sustainability on food that we apply in our hospital at the Adventist Medical Center, Manila. And that time I shared the anniversary that we celebrated. It was the 90th anniversary that we had, and we became a member of the Healthcare Without Asia. So it was a highlight. And I shared also that we have been serving plant-based healthy meals for the past 90 years. So that was a milestone, or something that we believe we have contributed in maintaining sustainability of this earth. And from that conference, we were able to network with many other members of that green hospitals, and we even had friends, Dr. Ming Nan Lin and his team, from Chuchi Foundation Hospital at Taiwan. They came over to the hospital and we had a pleasant exchange with them. And then my roommate at that time was Miss Clara Pai, and we have been communicating. I have been communicating with her even after the conference. And then in 2020, the pandemic came, and as Pat has said, it shocked the world. And it's such a big challenge, and we had to focus our energies and resources in facing the challenge of COVID. So the hospital services, outpatient, physical therapy, and our cafeteria, all those have to be stopped first while we are able, while we are getting our energies and how we can deal with the COVID, because our hospital also was a COVID hospital. But you know, in last November, again, 2020, we celebrated our 91st anniversary, and our team was resilient at 91. We are so glad we were able to work and become resilient, and we were able to go through while we having these lockdowns and the COVID-19. And at the height of the ECQ, the extreme community quarantine that was around March, April, May, we realized we have to continue the mission of the hospital, and that is excellence in faith-based healthcare, education, and lifestyle. And we need to help people to continue to live a healthy lifestyle amid the pandemic. Thus, on March 24, that is last year, we started the Lifestyle is Medicine. It's a Facebook live stream program. And in that program, we talked about all aspects of healthy lifestyle and also the specialties in our hospital. And that includes taking care of the earth and our environment. We focused on that also. And so this January 2021, we introduced the Lifestyle Intervention Program, which will debut on March 16, 2021. And this Lifestyle is Medicine Intervention Program is a 6-week program, which is 2 times a week, Tuesdays and Thursdays, with 3 hours meeting with the aim of helping people to improve their lifestyle and thus to be able to combat their chronic diseases and be able to fight the insults of COVID-19, because it has been shown by the World Health Organization that people who have these chronic diseases or comorbidities are the ones who succumb to the COVID-19 disease, especially the more severe ones, and even the deaths are higher among people with these comorbidities. So I would like to share what lifestyle means, and we'll show you how environment is medicine, because we have included taking care of the environment as part of this intervention program. I would like to share 2 short videos of our program.
Lifestyle is medicine. L is for laughter, the stress reliever. I for interaction, the friendly immune booster. F is for food and fluid, the taste of health and the thirst quencher. E is for exercise, the preserving power of motion. S is for sleep, the body restorer. T is for temperance, the key to balanced life. Y, your faith, the divine healer. L is for light, the energy giver. And E, environment, the lifesaver. Pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in divine power, These are the true remedies. Indeed, lifestyle is medicine.
Okay, I would like to share the other one where environment is part of this program.
Lifestyle is medicine. L
Oh,
is for laughter, the stress reliever. I for interaction.
sorry, I think that's the wrong video. Please skip me.
E. Environment is medicine, the lifesaver. Does your surroundings make you stressed or relaxed? We save the earth when we live a healthy lifestyle. Pure air, clean water, plant-based diet, and greener community build and support the life of everyone. Nurtures an environment that preserves resources for the next generation, reduces stress level, enhances brain function, promotes healthier lifestyle, improves work productivity. Then God saw everything that he had made, and indeed it was very good. Then the Lord God took the man and put him in the Garden of Eden to tend and keep it. Genesis chapter 1, verse 31, and chapter 2, verse 15. Preserve more, pollute less.
So thank you very much, and thank you very much for GHAC for making us aware to be caretakers of the environment. And this is a virtual program that we're going to run, and I can share to you the link if you are interested in how this program is run. Thank you very much, Pat. Back to you.
All right. Thank you very much, Doc Linda. Adventist Med creates the best videos. Um, and if you are part of the recent GGHH Philippines Assembly, Adventist Med actually talk about their advocacy initiatives. So again, thank you very much for sharing the GGHH journey with us, Adventist Med Manila, and Dr. Linda. Everything means a lot. Thank you very much. So of course, so for our next speaker, Shamsuddin Hospital in Indonesia is not only an active GGHH member in Southeast Asia, but they've attended, I think, almost all Green Hospitals Asian Conference, and we are very much grateful. To share more about their experience, let us all welcome Ms. Ni Putu Juanita Dewi, Law and Public Relations Officer for Shamsuddin Hospital in Indonesia. Ms. Dewi?
Hello, can you hear my voice? Hello, can you hear my voice?
If you can increase the volume of your mic, Ms. Dewi, if you can come closer to the mic, please.
Can you hear my voice now? Hello?
Just a little bit closer. There's a little bit of an echo.
Echo? Sorry. Okay. Now you can hear me?
Yes, I think that would work.
Okay, word, yeah. Yeah, good afternoon to all of participants on this online meeting. My name is Niputu Juanita and I represent Samsudin Hospital in Sukabumi, Indonesia. And on this meeting, thank you because I have a chance for delivery a simple testimonial about experience and listen about health healthier and more sustainable healthcare in our hospital, in Samsudin Hospital, especially with this pandemic COVID-19 and the climate crisis. Okay, in 1 year after the conference, as we know, Indonesia also got the pandemic COVID. And then due to the effect of the COVID-19 in our hospital, unfortunately, has been increased in the use of plastic packaging. So there are still some policy that cannot be implemented in Samsudin Hospital. And until now, the hospital also have priority to safety first for the employee and for the patient also. And
Excuse me, Miss Dewi.
yeah,
Again, if you can just come closer to the mic a little bit more, so
yes,
we can hear you better.
yes, you can hear me now.
A little bit more closer.
Little bit more closer. Now you can hear me. Sorry. Yeah.
Is this
Uh,
better?
Yeah, that's
yeah.
better. Yeah, that's better.
All right. Yes. Thank you.
Okay, so now the hospital have priority to safety first to the employee and the patient first with the use of personal protective equipment like use masker, hazmat, and etc. But for the handling of COVID-19 waste, our hospital is treated specific by being given a special place for the waste, and we do disinfectant. And then the waste is transported by a third party to be incinerated in another place. And also for the installation of LED lights in our hospital is on the way, still processing for 100% for LED lighting. And for also the detergent in the laundry hospital has been using environmentally friendly material. Also, we have the project. The project is about groundwater tank. We still running about the project because the hospital now is concerned, focused on dealing with the COVID-19. I think that's just a brief explanation I have now to say in this online meeting. I'm very glad if you have some advice or recommendation from all of you. Thank you so much. Back to moderator, please. Thank you.
Terima kasih, Miss Dewi. Your continued participation and support is very much appreciated. All right. So last but not the least, another solid, active, and close ally and GJHH member is the Buddhist Suchi Dialysis Center in Malaysia, who I'm sure have also attended almost all Green Hospitals Asian Conference. Without further ado, I am grateful to call on Ms. Tio Biling, GJHH Coordinator of the Buddhist Suchi Dialysis Center in Malaysia, to give her own GHAC testimonial. Miss Biling?
Hello, good afternoon, everyone. Wait, let me share this. A very good afternoon to all brothers and sisters from all over the world. My name is Biling. I am from Penang Buddhist Suchi Dialysis Center. And thank you for inviting me to share our experiences, especially during this pandemic. And those videos shown earlier were, really reflect back the very good memory of what we have shared in Singapore. And would like to share with you all that during this pandemic in March, that we had our movement control in Malaysia last year was actually on the 18th of March. During that time, there are a lot of things that we cannot do. but yet we actually concentrate during the critical earlier part was where we concentrating much more to the response for the frontliners in helping them and supporting them in a face mask, glove, and a PPE and all that. But there is two particular things that I would like to share with you all on what we had been doing until today is the fabric face mask. When especially in the initial start where everybody was very panicking and where we couldn't get the surgical mask, and especially for the public. So we actually involve a lot of our community volunteers to make the cloth mask and to help and support to provide this face mask for the public. And of course, very much in view of the reduction of waste and at the same time being, provide this protection for the public. And for the vegetarian meals, as you all know that our dialysis patients are actually those underprivileged patients. So during those pandemic, we want to ensure that all our patients and their family have their meals. So we actually also activate all our volunteers and provide all these meals in boxes for all our patients and their families. And of course, all these meals are plant-based meals, plant-based diet, and very much into our organization's mission, where we are promoting plant-based diet as part of our environment protection. And just now, the video show by Dr. Linda, it was very impressive, especially on the lifestyle is medicine and environment is medicine, whereby we have to preserve more and pollute less. And this is very much in line, whereby a plant-based diet is very critical and important during this critical time. And where we are very much looking into the waste as well. We do not use single-use containers. So we also encourage, what we doing now is that we provide these reuse food containers where we will, they will wash from the patient, they will wash, and then we will sterilize it and clean and sterilize it before we repack back and provide for our patients. And at the same time, in our kitchen, all these kitchen waste are kept and not thrown as rubbish or waste, but we make it and turn it into a compost and transfer it to our vegetable plots in our recycling centers. So this is also our initiative to reduce waste within our organization. And of course, the oil that used for our cooking, we also turn that into soap for our as a dish washing soap. So this is a little initiative during our pandemic, whereby there are a lot of other things that we cannot do, but these are the little things that we do within our organization. And as other than this, we also promote a plant-based diet in hospitals. So we are doing that in private as well as in the government hospitals, where we actually promote a plant-based diet. And here I would like to share with you a video, a very short video on one of the hospital where we promote a plant-based diet. Chrissy, can you share the video, please?
In recent years, vegetarianism In recent years, vegetarianism gradually becomes a dietary trend. Starting this January, Campus Medical Center in Johor Bahru, Malaysia, has increased their Meatless Monday campaign from once a month to every Monday.
On Ethical Eating Day, January 11th, Campus Medical Center decided to switch to Meatless Mondays every week.
Today is the 11th of January and also Ethical Eating Day. So I think starting the Meatless Monday campaign on this day is the perfect opportunity.
In the past, when it was once a month, it was widely received.
It's great, the taste is good, and it's helpful to our health and intestines.
Vegetables are not a problem. From a nutritional point of view, it's far healthier too.
I'm a biotechnology major, so I agree with Dr. Chua's thinking that meat is hazardous to humans' health, as it produces high levels of acidity in the body.
There are live demonstrations on how to make a delicious vegetarian dish, with the restaurant owner happy to change up the menu.
There are more and more people going vegetarian, so we want to introduce these dishes to people of other nationalities, as mainly the Chinese are used to these vegetarian dishes. Now others know that vegetarian food can be as delicious as well.
Their patients are not hesitant to try this and also agree with veggies being less of a burden on their body.
There's not a big change, mainly just changing animal protein out for plant protein. The daily nutritional values are still met each day.
With the entire hospital's cooperation, Campus Medical Center is the first medical facility to adopt Meatless Mondays every week in Malaysia and will surely be a role model for others to follow.
Okay, I will end my sharing here. Thank you very much, and we hope that we will actually promote more plant-based diet in hospitals. Thank you very much. Thank you.
Thank you very much. And to all our guests who have shared their testimonials, thank you very much. So this is not the end of our sharing. Everyone who is here today, you will also have a chance to share your GHAC journey with your other fellow alumni. So in this slide, we will all break out in different random groups, and you will have 15 minutes to talk about your experiences and learnings during the 5th GHAC in Singapore. And then after that, we are going to play an exciting game, and you will have a chance to win an exciting prize. So stay tuned. So in there. So I'm going to read the guide questions for the first breakout. So first, what motivated you to attend the conference? What expectations did you have in the conference, and how was it fulfilled? What are the lessons you learned in the conference, and how were you able to apply it in your own hospital, institution, or organization, specifically during the pandemic and the climate disasters that have happened? Third, what was your most useful or inspiring experience during the conference? And last, were you able to create partnerships and expand your network of professional healthcare workers through the conference? So in 1 minute, you're going to be assigned to different breakout rooms. But before that, so I'm just going to plug Healthcare Without Harm Asia is on Facebook, on Instagram, and on Twitter. And I'm going to post our social media handles in the chat box. All right, so just a minute. I'm going to break all the rooms.
Hi, everyone. Hello. Hello, good afternoon. How is everyone?
Hi, good afternoon.
Yeah. Actually, I haven't attended any GHAC yet, because I just been assigned here in Healthcare Without Harm Southeast Asia last year. So that's already after GHAC in Singapore. So I would really love to hear your experiences during that conference. So who would like to answer the questions first? Any volunteer from our...
Yeah, I can go.
Oh,
Hi,
hi,
this is Purnima.
Purnima. Hi.
Hello, pleasure to meet you. I think we've interacted on emails, but yeah. And hello to everyone over here. I can see people from, I think, HECAF and Nepal, and I'm not sure who else, but yeah, hello, I'm Purnima Prabhakaran, and I am one of Healthcare Without Harm India partners from the Center for Chronic Disease Control in India. And for me, the fifth GHAC was really a beautiful experience. It was my first GHAC, though I have worked with Healthcare Without Harm since 2016. A couple of my other colleagues, because of funding constraints and stuff, attended the earlier GHACs. I attended the one in Singapore. And it certainly was a beautiful experience meeting and interacting with Healthcare Without Harm partners from around the world, as well as the, the wonderful host that Putekwa Hospital was. I mean, it was such a lovely venue. We were wondering whether it's a garden in a hospital or a hospital in a garden. It was so green, and their strategies and operations are also so green. We learned that whether it was the plant-based diets or everything else across the operations, which we saw when we did the sustainability walk that was organized at the end of the conference. So it was beautiful networking opportunity, and we came away with a lot of fond memories. And I'm sure other colleagues will want to share their experience. I'll stop there. Thank you, Chrisia.
That's nice, Purnima. Okay, we'll hear from others. Okay, just after Purnima is Tirtha of Nepal from the list. Yeah. I'm just going from the list. Okay, hi Tirtha.
Hello. My video is not.
It's okay
working.
now. We can see you.
It's working. Yeah.
Yes.
Yeah.
So how's your experience?
Yeah, I was also there with my colleague, one colleague, and there was also ECAF team from Nepal, and yeah, I learned a lot, as Purnima shared. No, that was a kind of first experience where we see that a big hospital is maintaining all kind of waste management and also environment impact. I mean things, no. So that was very good learning. And after that, we had one national workshop in Nepal. It was big workshop, and due to that networking, I will say, we had invited many speakers from Health Care Without Harm. Ruth was there from India also. We had invited, and HECAP team, they have supported a lot to organizing that national workshop. Although it was organized by ministry, but as a supporting partner, GIZ, WHO, and other partners were supporting to organize that. So it was very nice and fruitful, particularly to have good network worldwide, no, with experts in healthcare waste management related things. Thank you.
Thank you for sharing, Sir Tirtha. I'm really excited for the next GHAC. Next on my list is Babita. Babita, I'm not sure if his or her, she or he. Babita. Okay, let's skip. She got out. Michael. Michael. Hi, Michael.
Hi, Mom.
Hi, Michael. How was your experience in our last GHAC?
It's okay, Mom.
Yes, you are from What organization and country?
From Our Lady of the Rule Maternity and General Hospital, Lapu-Lapu City, Cebu, Philippines.
Oh, we're in the same country. So how was
Yes,
your
ma'am.
experience? Were you amazed
Very,
by KTPH as well?
yes, ma'am. I was amazed.
What lessons did you learn so far, and were you able to apply it in your Our Lady Hospital?
As of now, ma'am, I am applying for the conservative method, ma'am, like reduce plastic and then convert recyclable materials into reusable materials.
That's nicer. So any other inspiring experience you had in Singapore?
Last last experience in Singapore was the meals, ma'am. Uh, they substitute meat with vegetables like that, ma'am.
Yes, I was also informed by that, and I'm really jealous that you all get to
Yeah.
taste that dishes, and I hope to also taste good dishes in our next GHAC. So,
Yes, ma'am.
okay, so I see here Miss Neff. So she's part of the secretariat. Would you like to share as well, Miss Neff?
Hello. Hello. Good afternoon, everyone.
Good
It was also
afternoon.
my first time, even though I've already 5 years from Healthcare Without Harm Asia. So it was a very fun, tiring experience in Singapore. But yes, I've also experienced the vegetarian food, the drinks, herbal drinks also, and the fruits were also delicious. It
So
was a fun
everything is
experience.
worth it, right, Miss Neff?
Yes, it was worth it. Thank
Even though
you.
you're the secretariat and you've been tired all day during the
Yes.
conference. Okay. So
Looking forward for the next one in India.
yes, I think Purnima will be uh, telling us about that later on. So because it's a surprise for now. Okay. So yeah, I think we're done. Do you have any more experience? Because I can share any. I'm just really excited for the next GHAC. We still have time if you want to share more. Anyone? I think Purnima wants to say something.
Yeah, I think the last GHAC was very well organized. I think have to hand it to Mon and team at the SIA Office of Healthcare Without Harm. A lot of effort went into the organizing, and the venue was very good. I think the all the transport arrangements, the accommodation, and all the events around it. We had these sustainability walks, which were very interesting and very relevant to the whole theme of the conference and why we were congregating there. And of course, after that, we did have post GHAC Congregation of Healthcare Without Harm partners, which was also a good opportunity for people to touch base and meet everyone from other parts of the network. So I think that was also a good strategy to plan it because many people were coming. It's called Green Hospitals Asia Conference, but it had participants from other parts of the network in the US and Europe. So that was a good opportunity to meet everyone. Just very good experience. We have, yeah, good memories.
Yeah, so just like what Tirta said, very good opportunity to network really with other healthcare professionals. So you can really talk about any topic that you want regarding environment, climate change, and what you can do with your own country, right? So
Right.
great platform as well for learning. I've heard that you've been with educational tours. So how was your experience with those sites? Were any of you in the educational tours, join the educational tours?
We were in Siloso Beach. I was the one coordinated there.
Wow. So how was your experience in that beach?
Um, they showed us the plants they were in the worm. There's they have types of worm for the all this. They
Worm?
have worm there. Yes, the type of worm that they use
Oh.
to decompose their trash or their
Oh.
yes, the one they use every day for the restaurant.
So all the restaurants are using that.
Yeah, I
Is
do.
it vermin? No.
No.
Let's check it after. Okay, so they're not letting us back yet to the main room. I think we still have
Uh,
time.
I was there in I forgot the name of that place. That was one big water treatment plant, where
Oh.
from where the water is supplying to the whole city. So that was very informative how they are managing the water supply and treatment and other things. Yeah.
Yeah.
Okay.
I think there were three tours. One was the hospital itself, the host hospital.
Yeah,
Yeah,
hospital
they
also we
had their
had.
own, the waste management, the food. They grew food on their roof. So that
The
Yeah.
was
rooftop.
very interesting. Yeah.
Rooftop garden. Yeah, I remember.
Mhm.
Yeah.
And then the other one was, I think it was the barrage or something close to the docks.
Yeah,
Where
yeah.
I
Baras.
missed that one. Yes, and then the Silvassa, the resort.
So
Them
what's
high on sustainability.
what's with the Marina Barrage? The barrage. What's in there? Can you remember?
I missed that one because we had to have pre-meeting in the resort. But yeah, I think
Okay.
Mr. Tirtha from Nepal was there. He just
Yeah,
said.
I was there, and it was like they are collecting the water from river, I think, and they also showed how they are trapping the water and then treating that water, pumping them, and then supplying to the city. No, so yeah.
Oh, we have a new member, Mazrur Azam. Sir, can you hear us?
Yeah, hi.
Hi, can you
I
share
can
your
hear you.
experience with us during the 5th GHAC in
Uh,
Singapore?
I am actually a part of Center for Chronic Disease Control from India.
Oh, same with
I
Dr. Purnima. Am I right?
yeah,
Uh-huh.
we are from the same team. So last fifth GHAC conference, I was not present in Singapore. So
Oh.
I'm experiencing it virtually right now.
So same with me. So you're attending this because you'll be part of the organizers for our next GHAC, right?
Yes, absolutely.
Okay. So okay. We're just both excited. They're making us jealous of what they've experienced last year. So we should probably really go to that 6 GHAC next year. And we're just hoping
Yeah,
that the pandemic's already over by that time.
yeah, absolutely. We all hope so.
Yes. Okay. So, yes, they're not getting us back to the main room yet. So, were you able to create partnerships during that conference? So, can you name if you've met someone that you're still communicating with until now? Or you have partnered with in their hospital or their institution? Tirta, you mentioned that you've had network expansion a while ago. Oh, I think we lost
Yeah.
Tirta. Oh, yeah. Okay, he's back.
Yes, I mean, we are very, how to say, closely working with Healthcare Without Harm Network. And as I said that during last year, December, we had a national workshop and we had invited many experts uh, uh, from that Healthcare Without Harm Network and Green Hospital Network. About 4 to 5 uh, experts were invited. Ruth was there, and I now I am forgetting the names. Philippines colleagues were there. No, so many people were invited due to that network, no networking.
That's great.
And it was a great uh, experience sharing and learnings from each other, no. So it was a kind of high level workshop where our health minister was there, secretary was there, uh, two ambassador was there. So it was very good networking. And at local level or our national level, we had invited private sector partners, also local government, provincial governments representative was there. So it was very good um, learning
Event,
exchange, you can say. Yeah.
So are you also partner with HICAF or you're part of
Yeah,
HICAF?
HICAP is our partner, and right now during this COVID, we are providing extensive support in 13 major hospitals of Nepal in healthcare waste management, and HICAP is the partner who is supporting technically, and time to time we are taking advice from Ruth also. She's also involved. So yeah,
Nice.
GIZ have good network, you can say, with the
Yes.
healthcare without harm.
Even here in the Philippines, HICAF is our counterpart of the Global Green and Healthy Hospitals in Nepal. So in Southeast Asia, it's GHAC, then in Nepal, it's HICAF. So great to know that you are partners with HICAF. Okay, I think we only have, we're going back now to the plenary. So just a few seconds. We'll be back. Thank you so much, everyone, for your sharing. I also learned a lot, and I'm really, really excited for our next conference. Announcements
Thank
later.
you. Thank you.
Thank you, Priscilla.
Thank you. Bye. Back to the plenary.
All right. I think everyone's back in the plenary session. Please let me know if there are still some people who are in the breakout rooms. All right. So if everyone's here, drum roll, please. All right. So I bet you guys had a lot to talk about, celebrate, and memorialize. A lot of memories came back. You've seen familiar faces, friends, and colleagues that you have met during the fifth GHAC in Singapore. But there's more. And I hope our memory won't fail us because we are going to play a bingo game featuring all the fifth GHAC activities. So can you still remember all the activities that we have done? Um, the yummy dishes during the lunch buffets, the plenary discussions, the breakout discussions, as well as the educational site tours. So if we can still remember everything, then I'm sure you're going to win this game. So we are going to have three winners. So let's look at the mechanics first. Krisha, please. All right. So the participants, you need to cross out a complete diagonal, vertical, or horizontal line to be a winner. And then the participant who completed the line will need to input the line code, which we are going to show later. So you're going to input the line code, for example, R1 in the chat box. There. So if you've completed, for example, completed the 5 plenary sessions, implemented a GHAC learning, availed the early bird rate. So the code for that horizontal line is R1. If you, for example, completed the middle vertical line, C2. So for example, if you've implemented a GHAC learning, you've tasted a new dish from Impossible Foods, and you've participated in at least one of the pre-conference sessions, then you are going to input a C2. I hope that's clear. I hope the instructions is clear. So this is a and then, so after you've inputted the line code that you have completed, the first to key in the code will be called for verification. The moderator will verify with the participant if he or she indeed completed a winning line. But we're going to have 3 winners. So the first one is going to input the code, second one, and then the third one. But it is up for verification.
And the prize, Pats. What would be the prize for our winners?
Yes, of course. And the prize is, drum roll. The prize for our 3 winners is you will each win 1 free pass to the 6th Green Hospitals Asian Conference. That's happening next year, 2022.
Wow.
Yes.
Wow.
So,
You mean they don't need to pay a registration fee if they win?
no need. They just need to go where the conference is going to happen.
Wow.
Yes.
And it's in India.
Okay.
Yes,
Oh, wow.
it's India.
All right.
All right. So are we ready? Is everyone ready? If you are, you can chat in the chat box and then you can say if you're ready. Ah, we have not yet started. I'm sorry, Radhika. All right. So without further ado, on the count to 3, you will be given 2 minutes to complete the bingo card. All right. So ready. 1, 2, 3, go. All right, so we have some inputs in the chat box. Krisha is the one who is going to verify your answers.
Okay. Let's start. Am I right? The first one to input the answer is Radhika Gimire. Am I right, Pat?
No, we haven't
No.
started down yet.
Oh,
Yes.
okay. So
the first
Miss
one is Sujata.
Sujata.
Yeah.
Sujata.
Data.
Sujata, can you unmute, please?
Yeah.
And we'll have some questions for you. Can you turn on your camera so we can see you?
Okay. Okay.
Okay. Hi, Sujata. So your answer is R2. So let's
Hello.
verify the first one. You participated in at least one of the educational site tours. So can you tell us the name of the educational sites that you went to and give us your experience and the learnings you had on that site?
It was near the something island, I think. I forgot the name. In the Singapore.
Okay. We would need the exact name of the place for you to be a winner.
Chile.
Okay, a few more seconds for you to remember it.
Siloso.
Okay, we're getting there.
Siloso Island.
Oh, is that acceptable, Pat?
Let us ask our executive director, Ramon San Pascual.
Yeah, that is fine. Yeah.
Okay.
Siloso Beach Resort or Siloso Island. Yeah.
Okay, so that's one correct answer. The second one would be, what is the main ingredient of the dishes during the lunch buffets served by Impossible Foods during the conference?
It's it's something from the I don't know the main ingredients, but I think it's tofu, kind
The
of
star
tofu.
ingredient.
Ingredient.
Again, it's a type of
Tofu.
It's type of
he
tofu.
said.
tofu.
Yeah, it's a type of tofu.
Okay, we need to confirm that. Is that right, Pat, Sermon?
Yeah, that's what I remember too.
Really, sir?
Different ways of cooking tofu. Yeah.
It's a bit different
that's
from
a good
my
answer.
note.
Yeah.
Impossible Foods, they actually serve veggie meat.
Yeah, that's another thing. Yeah, a lot of veggie meat. Yeah. Yeah.
But is the answer acceptable, Sermon and Pat?
I'll accept it because there's so much
Okay.
tofu in the across the lunch.
Different kind of tofu. I
Okay,
don't
yes.
know.
Yeah.
Okay. So lastly, met a new colleague or friend during the gala dinner and cultural night. Can you introduce your new colleague or friend to us and how describe how you met?
Gala dinner. Okay.
Yes, during the gala dinner and cultural night.
I think she's Miss Billy from
Our speaker from Malaysia.
yeah, Malaysia. In dinner, I met her, and we have an introduction from Mr. Mohes. And then now we are we know each other and we are friends.
Okay, okay. So I think that's acceptable. So Miss Sujata just won a free pass registration fee for our next Green Hospitals Asian Conference in 2022. Yay!
Thank you. Thank you.
Our finance team will be coordinating with you. Please message us your email address or contact number
Now?
in the chat box, if you may.
Okay.
Thank you.
Okay. Thank
First
you. Thank you.
Okay. Next one. Since we already answered R2, we'll be moving to the other a line, or what they call that one? Bingo. Bingo line. Okay. So is that okay, Pats? Since we already answered R2, so we're moving on with the other lines. So the next one who answered is C2 for Purnima. Dr. Purnima?
Yeah, hi.
Hi. So, what is that one learning that you implemented in your institution?
Um, so I think we can, I can safely say that the learnings with regard to green procurement is something that we discussed a lot at the GHAC, and it was also part of a pre-conference workshop, which answers the third box in this line that I participated on, the procurement, sustainable procurement pre-conference session. And I don't have my own hospital institution, but I head the network of institutions that we have, the India arm of the Global Green Hospitals Network. So one of our government institutions, which is the nodal agencies for the climate change program in India, decided to incorporate sustainable procurement within their operations. So I think that was a win for us. And my colleague Ishika is here. She is the project officer for that team. I think that's a plus for us.
That's great, Dr. Purnima. And do you remember any dish that you tasted during the lunch buffets?
So again, I cannot remember the name of the dish, but there was one day when
describe.
tasted something which I really thought was made of mushrooms, which I love. And, and I learned later that it was something else, which was again plant-based, but it was like more like a water-grown plant or something. I don't know the name of that. So if I get disqualified for this, it's fine. But it really tasted so good, and it tasted like mushroom.
Mushroom.
So
Okay. And
it
then
wasn't.
And then you participated in one of the pre-conference session. Can you name a speaker on that pre-conference?
Mohammed Amil. He was from India, and he had come to this session.
Yeah. Okay. But you know, Dr. Purnima, I don't think you would need a free pass for our next GHAC.
So I'm happy to hand it over to whoever is the next winner.
I think that's a good idea. I think that's
It's
a
just
good
for the
idea.
fun of participating. So thank you.
Thank you, Dr. Purnima, for sharing. Our next, our next participant who will have a pre-pass is Joshua from St. Paul Hospital, Iloilo. His answer is C1. Hi, Joshua. Are you here? Can you please speak?
Yeah, he's here. I think he's in the mute. Yeah, he's muted now.
Mute. Please unmute. Mr. Joshua?
I think he has a problem with his mic.
Oh. Oh, that's so sad.
Oh, I don't have a microphone. He said it in the chat.
I can see that chat. Oh, okay. So what should we do? We'll move to another participant?
Yeah, I think so.
Okay.
Because we want to hear the experience. Yeah.
Yes. So we already have C2, R2. Okay, we have one, R1, Ananya. Ananya?
From India again. See, Ms. Ananya.
Miss Ananya. Hello, can you hear us? Hello, Miss Ananya. Can you please speak? No? Okay. Should we count? Miss Ananya?
Yeah.
Okay, we still
Count,
have
please.
more. Okay, so Miss
Can have another one.
here. From Adventist C1, I guess, because R2 already is completed. Adventist, oh, Dr. Linda. Dr. Linda, C1. Dr. Linda? Huh? Why can't I hear everybody? Is it my...
No, you're clear. But I don't see Dr. Linda now.
Okay, so R2 has already been completed. C3, that's Mila. So Mila. Hello, Mila.
Sorry, I did not.
Hi. Hello. Can you hear me?
Yes. Sorry, Dr. Linda, you missed the chance. We're very, very
Okay.
sorry. We move on now to Mila.
Yeah. I
Hi.
am Mila, representing ONAP. I am from ONAP, Occupational Health Nurses Association of the Philippines.
Wow, from
I
Onap, Philippines.
C3, yeah. I chose C3 because I was able to avail the early bird rate. And with that, I had a problem because of the scheduling, that it was changed, and my flight. I'm quite late in attending because my flight took how many hours. So I arrived in the site quite late. Okay. And then that is, I was able to avail the early bird rate. And second, I met new colleagues and friends during the gala dinner on my table, particularly Dr. Linda Verona and Lady.
Oh.
Yeah.
So colleagues
And
from the Philippines also.
yes, in the Philippines. And I implemented the GHAC learning, that is particularly the use of plastics, because I enjoyed the giveaway tumbler. Remember the tumbler given by the hospital? But
Yeah.
so when I went back to Saudi, I taught my students to use tumblers not made of plastic. Okay.
Very nice, very
Implementing my
good.
own personal life. Yeah.
Okay, and because of that, you won a free registration for our next GHAC. Yay!
Yes,
Okay,
yay. Thank you.
congratulations. So also kindly input your name and details, email and contact numbers in the chat box so we can coordinate with you after this.
Okay, thank you. Yes, I will. I will. Thank you very much.
Clap. Okay, I can see others. Okay. I would like.
It's Miss Linda
Yes, Pats.
or Linda. No, I
Dr.
mean
Linda.
Dr. Linda's a chance.
Yeah. We'll give back the floor to Dr. Linda. Dr. Linda? Okay. Dr. Linda, we're giving back the chance to you. Okay. She's not on her mic. Maybe even if the row has already been answered, we'll go back to those who inputted their answers in the chat box. Is that okay for everyone? So I'll call again those who answered, and then in around 5 seconds, if you don't answer, then we'll move on to the other participants who answered. Is that all right? It's the last one. Okay, Dr. Linda is again here. Dr. Linda. Dr. Linda, you're on.
Yeah.
Okay,
So what?
Dr. Linda is back. So C2
Anong
is your
gagawin
answer.
kung C2?
So C2 is your answer, Dr. Linda.
Yeah.
You need to share with us. Oh, you already shared a moment ago, so it's already okay.
Yeah.
So do you remember any dish that you had during the conference?
Yes, the patties and the one that is wrapped in, it's like wrap, and there's vegetarian meat inside.
Oh, so
the patty. Oh, yeah.
patty dish.
I
Okay.
even took pictures of them.
Wow.
And
Okay.
yeah, and the
That's
ones
good.
that are the okra that was put in a stick and then dipped in a sauce. Those are the dishes that I tasted.
Seems
And the impossible meat, possible food is the patty.
Yes. Okay. Okay. That's good. Dr. Linda, how
Remember
about
well.
the
You remember well.
yes. How about the pre-conference session? Can you let us know one speaker during that pre-conference session?
Yeah, there was a presentation from Mary Johnston Hospital and also from, I think, Alabang Medical Center. So those are the deep dive sessions. Those are the ones that I remember.
Okay, so
Plastics. Yeah.
okay, so
yeah, the plastic inventory something.
okay,
Yeah.
so I guess Dr. Linda already completed the bingo. So congratulations, Dr. Linda. You have a pre-registration for our next GHAC. So we will coordinate with you regarding this. Congratulations. So congratulations to all the winners. I'm giving back the floor to
Thank you.
That's for the next part of our program.
All
Congratulations.
right. Thank you very much, Krisha. And congratulations to all our winners, Miss Sujata, Miss Mila, and Doc Linda. So you each won one free pass to the 6th Green Hospitals Asian Conference happening next year in India in 2022. So it's a 3-day, I believe it is a 3-day conference
Wala nang
also.
COVID.
So free. The whole 3 days is going to be free.
Wala nang COVID. And there's no
Yeah,
more
it's,
COVID.
Yes, well, yes, definitely.
thank you very much.
Um, so
Thank
thank you
you.
very much also to everyone who participated. And I'm sure the 5th GHAC was memorable in a lot of ways for every one of us. And with that, I'm going to segue again to a more serious discussion. So we are going to break everyone in random groups again to discuss your expectations for the upcoming 6th GHAC, which will be facilitated by Healthcare Without Harm Southeast Asia staff. In 2 minutes or at least 1 minute, please accept the request to be in your assigned room. And I hope everyone participates in this final breakout session. And you will be given strictly 20 minutes to discuss. So let me just again read the guide questions for the second breakout. So first, what support would you like from Healthcare Without Harm that you want to be fulfilled through the next GHAC? What are your expectations also for the next upcoming conference? Whether that is on the discussions, on logistics, on the format of the conference, or with regards to the budget and the registration fee. Next, how will the current pandemic situation affect the whole conduct of the conference, the 6th GHAC? And finally, what excites you about the next conference? So you will have our staff to facilitate the discussion. I'm going to break all the rooms now.
Hi, everyone. Oh, we have the same group from from before. Yeah, except for Miss Mila, the winner, our winner.
I
Okay.
lost my internet a while ago. Sorry, was not
Oh.
able.
It's okay, it's okay. This discussion, we will focus more on our expectations for the next GHAC because it will be something different from our previous ones because of the pandemic that's going on
Yes.
right now. So we would like to get your input so that we will bring more learn experience and experiences for you for the next GHAC. So I am with my colleague, Miss Neff, who will be taking down notes of your suggestions for our next conference. So maybe I would start with our winner, Miss Mila, because
Oh,
I'm already sure you have a registration pass
yes.
already. Okay. So what do you think would be
Okay.
the support you need from us, the organization, that you like to be fulfilled through the next GHAC? So what are your expectations in terms of discussion or topics? What would be the what that you really needed? Um, if in terms of logistics, would you like it to be face to face, or will you be more safe if we do it online? With the format, would you like more speakers or more interaction and the budget and so on? So please go on, Miss Mila.
For me, because I am a teacher and I'm a nurse, so best is still face to face because I can see the whole picture, the whole person, and the whole personality of the conference. That is what I like. But of course, it depends because it would be in India,
Mm-hmm.
so we have to see whether it is safe already to travel. Okay. Now, my expectation is how will the GHAC be able to do something that is very strong? Because the number one problem that I met during the pandemic is the usage of plastics, styropors, everything. Because they said that you can just easily discard.
Mm-hmm.
Okay, you
Okay.
sanitize, you eat, and then you throw away even the spoon and the fork. So uh, it is very very hard because one speaker I heard
Mm-hmm.
in one of the webinar I attended is the best is still plastic because you can easily throw it away.
Mm-hmm.
But in our part, it's not good,
Mm-hmm.
right? Because of
Yes.
the plastic. That is how will GHAC strengthen, you know, strengthen this policy that plastic is not good, plastic is not healthy, and
Mm-hmm.
that's not the way to take good care of the environment.
Yes. Yes.
Okay,
That's one big contribution to
a
the.
big, yeah, it's a very very big tasks,
Mm-hmm.
right?
Yes.
In
Yes.
the face of pandemic, and hopefully this pandemic will end soon.
Mm-hmm. Yes. We hope so too. So what excites you, Miss Mila, about our next GHAC? What excites you the
Oh,
most? What are you expecting? Is it the
of course, the
food, the view?
discussion,
Okay,
the
wow.
discussion. Number one is the discussion. Um, the discussion, and then of course the people. I will be meeting new people again.
Mm.
And thirdly is the place. The
Okay,
reason why
yes.
I want is to be face to face. I would like to explore, explore the place. So because I have friends that came from India. My co-teachers in Saudi are five Indian teachers. So I would
Mm.
like to see their place.
Yes.
Okay.
It's the place of Dr. Purnima here. We have right now in our
Oh,
group. Yes.
yes.
Okay, so it's the place really. I also wanted to see the place as much as possible. So
The place, their culture,
yes,
of
experience their
course,
culture. Yes. Mm-hmm.
and their food. Their
Indian food.
food.
Yeah.
I like Indian food. Yeah.
Yes, yes. So, in terms of the format, Miss Mila, because you're excited about the discussions, the learnings, what would you like more? Should we ask for more speakers for one-way learning, or would you want to have more discussions with your co-participants during the conference?
Oh, what I want is more discussion among the participants.
Okay, so
Okay.
sharing time.
It's like a workshop. It's
Mhm.
like a workshop
Okay.
wherein we exchange ideas, opinions, and discuss what is what are feasible
Mhm.
and what are not feasible policies.
Yes, yes,
That's it.
that's great. That's a nice comment insight, Miss Mila. Okay, thank you so much for all your answers, Miss Mila, and we hope we'll be able as organizers
Okay.
fulfill your expectations for our next GHAC. So I should call on
Yes,
our
thank
next
you.
Pradnya Paramita.
Yes.
Hi,
Hi.
Miss
Yes.
Pradnya. So
Yeah.
would you like to answer our questions? So it's about your expectations for our next GHAC.
Okay. My expectations, I think COVID's gone. So
Mhm.
we can have a good conference and we can do something more about the real life. It's not a Zoom.
Oh, okay,
Okay.
so face to face. Yes.
Yes. But again, if it is a Zoom, that will be a very good in term to do some kind of the research. So I think it's a more research. We have to what you call it, talk about it. Yeah.
Research. Okay, so research. And on topics, do you have any suggestions or recommendations? So Miss Mila recommended more on plastics, strengthening the policy on plastic use. And then how about you?
Yeah. Plastics, yes. But another things
Mhm.
is about a water treatment.
Water treatment. Mhm.
Yeah.
You
Mhm.
you are from what country, Miss India also?
Indonesia.
Okay. So are you having problems with water treatments?
Oh, I think it's for the hospital. Yes.
Mm-hmm. Okay, so water treatment, yep, in healthcare facilities is really
Yeah.
a problem, yep. Okay, and then would you in terms of budget, because you'll be coming from Indonesia
Mm-hmm.
to India, you will be flying, and would you recommend anything like lower the registration fee, or would you have any problems with the budget if you will be flying to India? Given that we're already in a crisis right now.
Well, yes, I know. But again, of course, it's a budget of the accommodations and also the fee for the conference. And
Mm-hmm.
so if it is you make it some kind of a package
Package,
and then
okay.
yes, that will be helpful, yeah, for to think about it to do and to go to India.
Oh, that's right. That's a good suggestion because I think the team haven't done that yet
All
with
right.
other
Because a packaging, let's say for 4 days 3 nights will
Mhm.
include the accommodations and
Accommodations.
travels
Mhm.
and the conference. It costs like that. Yes.
Okay, yes, yes, that's
Okay.
right. Yes, that's a great suggestion. Thank you so much for that. And then
Okay.
what excites you the most?
You're welcome.
What excites you the most about our next GHAC?
Exciting.
Yeah.
If it is in India, I
Yes.
will just see the most popular in India.
To see the
It's a
place,
Taj
yes.
Mahal. Yes.
Oh,
Uh-huh.
Taj Mahal.
Yeah.
I'm
Is
not
it?
sure if
It's a far away. Oh,
for
okay.
Mima, would we
But
be
again, yeah.
able?
If no. Okay. About okay. What I'm thinking about. India is a very popular in developing hospitals base and education. I think from my expectations, I will just gain some things so that I can make it also the similar to more what you call it, a push our students and
Yes.
our staff is really focusing on their works, because I think India, maybe because of the populations and also about the competitions, it will be become a very tight. But again, I think I'm really what you call it, amazed that you are very fast on in term of doing something rather than in Indonesia. Yeah.
Yes, yes.
Okay.
Okay. So thank you so much, Miss Pradnya,
You're
for your
welcome.
comments and recommendations.
All
We've
right.
taken note of that. So okay.
Yeah. All
Moving
right.
yes. Moving to our next group member. Oh, Sir Kirta, you're also here again with us. Sir Kirta, hi.
Hello.
Hi.
Um, hello.
Yes, I
Are
can
you?
hear you.
Yeah. Um, yeah. From my side, I think what we are facing now due to COVID, this increasing burden of infectious waste in the hospital. So it would be nice if we have some a special session on how we have succeed or we are doing the healthcare waste management practice during this COVID. Uh, and we are also getting some special request from our partner hospitals in Nepal,
Nepal.
particularly the big hospitals about the liquid waste management. So yeah, so these two things I think would be good topics for discussion. Yeah.
Okay, that's well noted. And then how about the format of our conference? Would you like it face to face, or would you be okay with online conference since you'll be coming from Nepal?
Uh, I'll be comfortable in online.
You'll be more comfortable.
Yeah,
Okay.
yeah, yeah.
So the rest of the team here is would like face to face already, but you'll be comfortable with yes, because we don't know yet as well how things will
Yeah,
change because of the
yes,
pandemic.
yes.
So we're also
Yeah, yeah.
considering that that factor. Okay.
Yeah, if things are normal, then obviously everybody is preparing face to face. That is, but at the current situation, I think we need to take precaution, and I'll prefer online.
Yes, we really need to
Yeah,
take precautions. Yes, that's right, sir.
yeah.
And then how about the format? Would you like to have more speakers or more interaction with your co-participants?
I would prefer more interaction
More
than more
interaction.
speakers. Yeah, yeah.
Yeah, everyone would like to have this because like what Sermon reported a while ago, the program in the last GHAC was so jam-packed that there's a little time for the participants to network and to uh, interact with their co-participants. So we would like to hear your thoughts on this. And then what excites you the most, sir, on our next GHAC? Oh,
Uh, it is in India, no?
yes.
So yeah, I am very excited because I have um, so many years I studied in India. I completed my bachelor from Madras. So yeah, it will be good time again to be in Nepal,
To
India.
go back to India.
Yeah.
Yes, wow, that's nice. So thank you, Sir Tirta. And from Dr. Purnima will be one of our hosts in India. So let's hear a few words from her.
Thank you, Crisia, and thank you to all the other participants here in the group. I think I was more here to listen because
Yeah.
the as the next host. It was interesting to hear the different perspectives. I think after one long year of staying home and no travel, most people are looking forwards to an in-person conference, which is encouraging because we are already starting the groundwork for exploring the venue, etc. But yes, with the caveat that we are not sure how the pandemic is going to pan out in different parts of Asia. So I will keep that at the back of my mind while I'm doing this, so that we have an option open in case it has to go, virtual or even maybe a hybrid model. I don't know if some people would prefer not to come and stay on a virtual platform. So it's good to hear all the different feedback. Of course, I hope we're going to get this feedback to us, the host team, in terms of also the suggestions that have been received for the different sessions. I think that will feed into our planning and also the discussion around the registration. So that's something that I will also look to discuss with the SIA office as we do our planning. That's it, I think, really, Chrisia, for me. Was there anything particular me about the next GHAC that we are hosting it?
Yes, we'll hear more about the next GHAC through Purnima later during the our program. Also, Tirta, it's okay. He already have to leave. So, yep. Since it's already 4, we're going back to our plenary. But I'm really thankful for all your insights, comments, and recommendations, and we'll take it to heart that we'll be able to fulfill it on our organization of the next GHAC. I'm very excited for this one because it will be my first. I also want a face-to-face conference as well because it's been a year that we're in a lockdown. We haven't gone out much. And it would be my first time in India, so I'm also excited. And I met someone from a conference as well, which is from Pondicherry, and really excited to visit their province. Okay, I think we're going back now. Miss Neff, were you able to take note of our discussion?
Expo noted all.
Thank you so much, Miss Neff. We will share it, of course, with the organizers of the next GHAC, all the discussions that we've had during this event. Okay, we're just waiting for our tech team to let us back into the plenary.
Can we also include site visitation, just like what happened in Singapore?
Site visit, yes, of course.
Yeah.
The site visits.
Yeah, site visits. Like I went to Chuchi recycling plant. I remember that.
Wow. So how was your experience?
Oh, it's awesome. I never thought that plastics can be turned into a blanket in a t-shirt, which are donated to countries that are devastated with hurricanes or storms.
Wow.
Yeah.
That's nice of
They recycled.
Singapore.
Yeah. That everything can be recycled, except of course for the bloody cottons from the hospital. And it's good the waste, the infectious waste recycling and in the hospital. Okay, so we're just waiting for us to go back to our plenary. Okay.
Yes.
Thank you so much.
Thank you, Miss Mila.
Yes. Yes.
All right. Yeah, okay. Our team is already. Okay, bye. Thank you so much.
All right, hi everyone. So we're just waiting for the others to come back to the plenary session, and then we can finally wrap up today's virtual reunion. In the interest of time, we might cut down a little bit. So, all right. All right. So I think everyone's back. So before we proceed to the final speakers to wrap up today's virtual reunion, I'd like to request Chris and everyone to turn on their video so that we can take a class photo. So if everyone's ready, Chris.
Hi everyone.
Hello, sir.
So please turn on your cameras.
Everyone, please turn on your video.
Still waiting for the others.
Sorry, hindi ako makapasok sa breakout kanina, ha? Sorry. Last breakout natin.
It's okay. It's all right.
Okay. Can everyone please turn on their cameras? Thank you.
All right. I think everyone's ready.
All right.
Others?
Smile.
Smile.
Pat, maybe you can count so that we'll know.
All right. Mina.
Okay.
All right, ready?
One more. Okay. 1, 2, 3. Smile.
You got it?
Yes. One more.
All right.
1, 2, 3. Smile.
Smile.
Okay. Thank you, guys.
All right. Thank you very much, Chris. We are going to share the materials that were discussed in today's virtual reunion, as well as our class photos. We're going to share that with everyone through email. So as much as we want everyone to make a report back, but we don't have enough time. Sorry again, if we can turn off our mic. All right. So so to keep the excitement as much as we can, I'd like to call on Dr. Purnima Prabhakaran, Deputy Director of the Center for Environmental Health and Public Health Foundation of India, together with Center for Chronic Disease Control, Doctors for Clean Air and Healthy Energy Initiative India, as our next conference host to share more about the 6th GHAC. Purnima?
Thank you, Pats. First of all, good morning, good afternoon, and good evening to everyone here. It's such a pleasure to be reconnecting with all the participants of the 5th Green Hospitals Asia Conference in Singapore in 2019, October. I think we have had an opportunity to reconnect today and share all our beautiful memories and experiences. So thank you to the SIA office for having conceptualized this idea and making it happen. And for those of you who attended the conference in Singapore and were there during the closing session, you will recall that the baton was passed on to India to host the next conference. So the 6th Green Hospitals Asia Conference is to be hosted by the Healthcare Without Harm India team, which includes my own team at the Center for Chronic Disease Control and the Public Health Foundation of India, along with Healthy Energy Initiative and Doctors for Clean Air. So Healthcare Without Harm has 3 partners in India, and we will together be your next hosts for the conference, which was originally scheduled for this year, 2020, August, September is what we had initially planned. But as we all know, we've just kind of surfaced and actually still resurfacing from the global pandemic. And we have now moved the conference dates to February 2022. What we have here on the screen is just a snapshot of Indian architecture. For those who are familiar, you will know that India is like countries within a country. We have a very, very diverse and rich cultural heritage. We have several thousands languages and very, very interesting range of cuisines. But as is tradition, we have decided to host the conference. Pat, I don't know if I can share my screen here. I did have something to show here, if that's okay, Tricia.
Yeah, please. Yeah, go ahead, Purnima. Just click share screen.
Oops, sorry. Yeah, so as has been the tradition with the Green Hospitals Asia Conference, we chose a location which is a city in the Union Territory of Pondicherry, which is located, this is India for you, and this is the southern state of Tamil Nadu. And this is where most of you are in Asia, and this is what you'll have to cross to come here. And this is a beautiful coastal city in the Union Territory called Pondicherry. And it has a cultural heritage which actually has a French influence, French, Dutch, Portuguese. So very intricately intertwined with the Tamil culture. So Franco-Tamil cuisine is what you'll be exposed to when you come here. Besides the sea, a lot of, you can see here the very quaint streets and the architecture, which has a very French influence, but you will also get a good flavor of South India. So we're really excited to be welcoming you here to India for the 6th Green Hospitals Asia Conference. The theme of the conference, which has been discussed with the SIA office as well as Global Healthcare Without Harm team, will be healthcare leadership for decarbonization, healthcare resilience, and healthy recovery, in line with what we are all experiencing just now in terms of the pandemic. We also have here one of our very active members of the India arm of the Global Green and Healthy Hospitals, the Arvind Eye Care Hospital, which is globally renowned for its sustainable operations in eye care, their eye care surgeries, etc. They are a chain of hospitals, but one of their biggest hospitals is in the city of Pondicherry. So we will certainly have another sustainability walk when you are here, apart from a lot of fun opportunities and high on sustainability. Welcoming you all and look forward to seeing you all next February. Please save the date. February 2022 is when we hope to host you all here in India. And thank you so much for all the feedback that you all shared in the breakout sessions. Very useful as we get into our planning now, both in terms of the content, the format, as well as what your expectations are. We'll certainly strive to live up to all of your expectations with your support and look forward to welcoming you. Thank you.
Definitely. Thank you very much, Purnima. And we are indeed looking forward to see everyone again in the near future, safe and healthy. So before we close,
we will reserve our ticket beginning tomorrow.
Sorry, Sermon?
We will reserve our ticket to Pondicherry beginning tomorrow.
We are very excited. All right. So
so I would love to have one to send it for me.
We will.
All right then. Okay.
So before we close and bid everyone a good afternoon, let us finally welcome Krisha Alyanige, the Global Green and Healthy Hospitals Coordinator for Southeast Asia, to close and wrap up this first ever virtual GHAC reunion. Krisha?
Yes, hi again, everyone. Thank you so much for being here this afternoon. I've never been into a GHAC conference before, but it feels like I've been there because of all your sharings and of experiences. And I would really want to taste all the foods that you've been sharing. And so I'm really excited for our next GHAC in India. But before that, of course, the Global Green and Healthy Hospitals in Southeast Asia have prepared a lot of activities for you this year. So that is in preparation for our conference next year. So this is all in the slide, but I will not be enumerating each because of the time constraint. But I would like if any of you would want to be a member of the Global Green and Healthy Hospitals and be able to avail of these resources, activities, and tools that the Global Green and Healthy Hospitals is offering, you are welcome. And we would love to have you on board our network. So just email us at greenhospitals.asia@healthcarewithoutharm or hcwh.org. And we are very excited to have you again on our next GHAC in India. And thank you so much again for being here this afternoon. So good afternoon again, everyone, and have a nice day.
Thank you so much, and good afternoon, and see you again soon
Bye-bye.
in India next year. Bye.
Bye-bye. Hi, Sir Dr.
Everyone.
See you. Bye-bye.
Thank you,
Bye-bye.
everyone.
Bye-bye.
Stay safe.
Bye-bye. Bye-bye. Bye-bye.
Bye-bye. Keep
Bye-bye.
safe.
Bye.
Goodbye.
Bye. Bye.
Ganun ka dyan.
Masyado kayo masyado inis eh. VP. Siya naman ini-stress ang sarili mo.
I'm just saying.
Number yan.
End ko na. Bye-bye.
Bye-bye.
Meeting pa ba?
Bias.
Ano?